So as stated, I'm Dr. Spears. I'm one of the newer additions to the movement disorder and Parkinson's disease team at the university. So I'm going to talk to you a little bit today. I've been tasked with talking about alternative therapies in Parkinson's disease. What we're going to do is we're going to cover a couple things. First and foremost, we're going to talk a little bit about really the overview of some terms. So we're all really on the same page with the language we're using, so we can have this open conversation about it. Next, we're going to talk a little bit about some of the pros and cons, and specifically the safety of some of these alternative therapies, because they're not all perfectly safe. I'm going to talk a little bit, and there's no way I can talk about every alternative therapy, so we're going to do hit some of the high points with the alternative therapies and do a little bit of show and tell as well, because there's a lot of very interesting alternative therapies out there. And then lastly, and this is really a big topic in Parkinson's and in general, is the role of medical marijuana. And just given by the number of people here, you guys probably ran out of the medical marijuana samples, or yeah. Are those? What kind of chocolates are those on the table? We'll see. One disclaimer I have, especially when talking about Parkinson's in general, is that every patient with Parkinson's is unique. There may very well be similarities between given patients, but every patient is unique. So that one patient on the internet who responds excessively well to marijuana with his dyskinesias, that may very well not be the next person. Everybody's very different in their responses to the medication and their needs overall. And I found really, especially on this topic of alternative therapies, that patients are really the best educators. You guys are the ones who bring all these new frontier treatments, these new frontier alternative therapies to the providers. And a lot of this and what I know is really based off of the experiences of the patients I've seen. So too often, I know that a perspective that many may have with alternative therapies, and it's probably tough to read this caption, but it's really the doctor saying to the patient that we've exhausted all conventional measures. One last desperate option is to put you on an alternative medicine that has 96% success rate. So I know that may very well be a perspective that a lot of folks have. It's not what we intend to do, though, and I'll try to talk a little bit more about that. But talking, or at least laying out the definition of alternative therapies, and plainly put, this is a diverse group of medical therapies, interventions, treatments, practices, or products that share in their common exclusion from conventional Western practices, really things that are alternate to what we do, mainly with pills and other therapies. I think that definition is tricky, and even the word alternative therapies is a tricky definition because it really implies that these therapies are really in opposition or to replace the therapies that we have conventionally for Parkinson's disease, things like Sinemet, or things like the medications we use for mood and psychosis in Parkinson's disease. And I really prefer the term complementary in alternative medicine, because these therapies, by all means, most everyone I'm talking about today, can be used alongside and together with our conventional therapies for Parkinson's disease. So I call them complementary and alternative medicine therapies. At large, this group of therapies, complementary, alternative, or what have you, really focus on individuality. They focus on the individual. And they also have this emphasis on holism, which is this logic of not just treating a disease symptom, okay? Not just treating a symptom of the disease, but that symptom of the disease pertains to the part and treating the whole. And that's, I think, something that's definitely something I took from this definition, and I think we should all strive to treat. Now, the thing about alternative therapies is that they're not routinely taught in medical schools. And so I remember back, and I think it's probably been about 10 years now since I went through the earlier coursework in medical school, and I think there was one day out of the entire 4 years where alternative therapies were brought up. And it wasn't just specific to Parkinson's disease, it wasn't specific to neurologic disease. These were alternative therapies across all of medicine. And that's really about the extent that we get as MDs and DOs in our medical school training. The other thing is that alternative therapies can be costly because they're not routinely or not always reimbursed by insurers. So this is something that by all means can have an effect on what we do in prescribing, and then of course have a negative effect on pocketbooks sometimes. And then in this last thing I have here, this last bullet of the three, is meant to be a double negative, and that alternative therapies are not uncommonly utilized. By this I mean that alternative therapies are pretty common, and we know that in the US alone, patients with Parkinson's disease, about almost 50%, 40% of folks with Parkinson's have tried some form of alternative therapy for the treatment of the symptoms of Parkinson's disease. And in Eastern countries, this number rises to about 3 in 4. 75% of folks have tried some alternative therapy for Parkinson's disease. We divide these, and plainly we try to divide these into things like natural products, mind and body practices, then alternative systems practices, which is a confusing term. But alternative therapies is really a blanket term for a lot of different therapies. Not just the things we think about with this class of herbal medicines and nutritional supplements, but we're talking things like homeopathy, chiropractic manipulation, acupuncture, naturopathy, massage, music therapy, and exercise therapy. And this is probably not an exhaustive list of what really in total makes up these therapies we call alternative therapies. So some general principles, pros and cons, and this is what I'm just going to call the rub. This is the rub in my mind, is that alternative therapies at large are not always well researched. And as physicians prescribing therapies and prescribing medications, we like to see research and evidence. We like to see the science behind the therapies we use. These alternative therapies are not always regulated by the government, namely the Food and Drug Administration or the FDA. And so this also plays into how we use medications on a frequent basis, in that we like to know, is this medication going to be effective first and foremost, or is this treatment going to be effective? How often do we have to give it? What dose do we have to give it? And what kind of side effects are we dealing with? And all that evidence, we just don't have a lot of it. We don't have a lot of it towards many of these alternative therapies. And this caption here just shows that, again, really hits upon again that even though a lot of these are natural substances, these are things that are felt to be in the environment. If the good Lord put them on earth, then they can't hurt me. There are a lot of side effects that can happen from natural therapies, and this is a cartoon with a woman who has flowers growing out of her hair after using the natural eye drops. So to tie into and really talk about more specific therapies, I just wanted to put up this slide, and this is from the National Center for Complementary and Integrated Health, which is part of the NIH, or the National Institute of Health, and they polled really and did a survey about what type of alternative therapies are used and what are the most common. Really out there beyond anything else, we know that really natural products are the most commonly used alternative therapies, with many others trailing behind. So when we talk about these natural products, what we're really talking about are things that are vitamins, minerals, and tinctures at large, and other herbals to that regard. The key points of these, and I'm not going to talk about too many specifically, is that, again, the U.S. Food and Drug Administration, the FDA, does not strictly regulate herbs and supplements. They just don't have enough manpower. They don't have that emphasis to do so. And the other thing is that there's no guarantee necessarily of the safety, strength, or purity of many supplements. There's just no good governing body. We just don't know what really is in some of the products that are really on the shelves at the store, which is a little bit disheartening, which is a little bit we have to be cautious about. We know that, though, to date, there have been no dietary supplements shown to halt, slow, or alter Parkinson's disease. None that have been shown to halt, slow, or Parkinson's disease. But it's not for lack of trying, because there have been a fair number of trials, some of them very good and very well conducted trials, looking at things anywhere from vitamin E or coenzyme Q10, which is a common one that's out there, creatine, ginseng, ginkgo biloba, uric acid, inosine, which is the other name for uric acid, and St. John's wort, and that's just to name a few. These are all trials that have been largely negative, or haven't shown results to be really beneficial for patients, namely for patients with Parkinson's disease. There are many, and because our trials can't keep up with all the alternative therapies, trials take a long time, they cost a lot of money to run, we're never going to be able to trial every alternative therapy. So there aren't trials for everything, and to name a few, we know there aren't trials for things like ginger, which is in the news, green tea polyphenols, or green tea, and milk thistle. And then again, capitalizing on this point at the bottom is that to date we just don't have any positive trials for these alternative therapies. But there are a couple alternative therapy honorable mentions. And some of these are really interesting, and some of them do have some benefit as opposed to some of the herbals and other supplements. One of which is really interesting, and this whole body vibration therapy. And there's an interesting backstory on whole body vibration therapy, which apparently developed out of, and this is old-timey docs. We're talking almost 200 years ago, where they noticed that patients with the shaking palsy or Parkinson's disease who came in on a long journey on a bumpy back road via horse-drawn carriage, if it was a bumpy ride, that patient looked better for a short while at the beginning of that visit. And so that, over time, and that interesting notation kind of really spurred this interest in whole body vibration therapy, which a number of trials have gone on so far. It looks like there's a little bit of evidence for it, and it's actually still actively being trialed for Parkinson's disease. I don't encourage anybody to shake their loved one or start shaking. There's a lot of bumpy back roads, and I think even bumpy front roads here in Michigan, I hear, and that may very well be enough. The other thing that's out there, and this actually has a lot of evidence, and I think it was trialed really right down the road at Cleveland Clinic, is the Theracycle. And the Theracycle comes in, at least I think last time I looked, the series is 100, 200, and 300. And this is a very special kind of stationary bike, which utilizes this principle called forced rate exercise. Okay, forced rate exercise. And so patients will get on the Theracycle. People get on this Theracycle, which really forces you to go about 30%. That's the sweet spot. 30% faster than your voluntary rate. So really getting your heart pumping, really getting you moving. Doing that for a period of time. And they found that, at least temporarily, after you do this workout on the Theracycle, you can have improvement in a number of motor symptoms. The speed of movement, the swing of movement, or reducing stiffness, and even walking a little bit better. But so far, those results have been temporary. Okay, and so unless you're going back and forth to the Theracycle every couple hours, right now, which I don't recommend, that would be exhausting. But by all means, we're starting to get some alternative therapies that have some improvement. I think, and I checked, it's hard to find Theracycles online. You can find them, and they go for a lot of money. These things are thousands of dollars. I encourage patients to go to a yard sale or garage sale and pick up a stationary bike for $10. It's a little bit easier on the pocketbook, as long as they really push themselves. But the Theracycle, by all means, is something that can be helpful. The other alternative therapy, and this kind of goes into that umbrella of herbal supplements or natural substances, is Mucuna pruriens, and this is a derivative of a bean, of the velvet bean, also dubbed at times the dopamine or the dopamine bean. It has a lot of different names to it on the shelves, and this is interesting because Mucuna pruriens actually does have one of the main components, one of the main active components that we use in a lot of our medications for Parkinson's disease, and that's replacing dopamine, or in this case, giving dopamine in the form of L-DOPA, which your brain utilizes and can help slowness, stiffness, and tremor. Now the thing is about Mucuna pruriens is that these beans contain just a little bit of the L-DOPA, and they don't contain that other part. For those familiar with Sinemet's the one name for the medication with two names, the carbidopa, levodopa. The levodopa is essentially the L-DOPA component, and that's the workhorse in that medication. The carbidopa component is important and included with that medication because it helps offset things like stomach upset and nausea and vomiting from the medication, and it helps offset or help decrease your body breaking down the L-DOPA before it gets to the brain where it can be active. And the Mucuna pruriens doesn't have a robust component of carbidopa. And so it's one of these things that if you need to eat enough Mucuna pruriens, enough of the velvet bean to get a more substantial benefit, a motor benefit from it, you may very well run into a little bit of GI upset. Probably great in areas where you can't have access or you don't have access to medications like Sinemet or these other medications we have for Parkinson's disease, and very well could have effect, especially for mild symptoms of Parkinson's disease. But as the disease becomes more advanced and the symptoms become a little bit heavier, I think Mucuna pruriens may be a little bit limited, but by all means is one that I don't naysay. So so we talked about a couple things, and we talked about the whole body vibration therapy, we talked about the TheraCycle, and then the Mucuna pruriens, which are all things that do have a little bit of evidence to show that they can help, at least somewhat. One thing that doesn't have a lot of evidence, although it has also been tried, is acupuncture. And so acupuncture, it really is this therapy based off of an imbalance or flow in energy, and you get poked with a lot of needles, which apparently don't hurt. I've never had acupuncture, but it really doesn't smart too much. But it's been tested for Parkinson's disease, and acupuncture is one of the things that hasn't shown a lot of improvement. But the thing that has probably shown the most improvement, and we know this, both immediate and long term, is exercise. Okay, exercise. And if I had, down in Florida, I had a prescription pad, and I would write exercise on the prescription pad and hand it to the patient. Here I don't have a prescription pad, so I just have to point my finger a lot. Exercise is the most effective, it's the most effective hands down alternative therapy we have for Parkinson's disease. And if I had a pill, if I could put this in a pill, I would, by all means. It's the most helpful. And the thing about exercise is it doesn't really matter exactly what you do. You don't have to be a weightlifter. You don't have to be a champion in that regard. You can do boxing, whether it be through Rocksteady or otherwise. You can do Tai Chi, has been found effective. And this is one that the female spouses always giggle when I say, but tango has also been found to be effective. So it's anything. It says any exercise, anything that gets your body moving, anything that gets your heart rate up for 30 minutes at a time, greater than half the days of the week, I usually say 4 days of the week or more, is by hands down the most effective alternative therapy we have for Parkinson's disease, both immediate and long term. And I've had many patients even stave off starting medications for Parkinson's disease really just by exercise. So we're going to change gears. We're going to change gears here and devote the rest of my time to talking about medical marijuana. Okay, medical marijuana. Now, the question about medical marijuana is one that comes up to really 95%, or just about every Parkinson's disease specialist. Here's the question, Doc, what about medical marijuana? Okay. And even though that question's posed often, we already know that about 1/3, 36% of patients with Parkinson's have tried medical marijuana or cannabis at some point in their disease. Now, I have to put a disclaimer on here as well, because right now, and right now, the environment is that marijuana is still federally classified as a Schedule I drug, meaning that the federal government doesn't identify that marijuana has a medical property or medical component, and identifies it really just as a drug of abuse right now, which really is tricky because that interferes with our ability to test it and then at large safely prescribe it and for anybody to safely carry it. So as I'm talking about this, I just wanted to give some credit to one of the movement disorder fellows at the University of Florida, Dr. Jakowiak. He's not here today, I don't think, but he provided a lot of these slides, and he's a great doc if you have a chance to see him when you come to the clinic. But marijuana itself, and we're not talking about CBD or anything like that yet, marijuana we know has about 60 active compounds. All right, 60 active compounds. It's a pretty crude drug or alternative therapy as it is just in itself. At large, the things that make up marijuana are these two compounds. THC, which is that psychoactive component, and provides that euphoria, that good feeling. And then CBD, the cannabidiol. And you don't get a lot of euphoria from that one. It can serve even as an antipsychotic to an extent, can break down anxiety a little bit, and people also believe it has anti-inflammatory, and for one specific condition, anti-seizure properties. But marijuana, when we're talking about marijuana itself, we're talking about both of those compounds, THC and CBD. And marijuana, whether smoked, whether vaporized, whether ingested, whatever mechanism, has a lot of side effects associated with it, or can have side effects associated with it, and these are real side effects. I won't read them all out to you, but the major ones are, it can alter your sensory perception, it can cause perceptual distortions and even hallucinations in some, it impairs memory and attention, it can make people hungry, and that one I think is very well known. And it can really change your gross and fine motor skills. Marijuana doesn't necessarily make you, especially from a Parkinson's disease standpoint, be able to use your hands better or be able to work with your hands better. And then chronically, we know that there can be a dependence on marijuana, medical marijuana, or marijuana in itself, and it can lead to cognitive impairments. And we're even starting to identify now that it can even promote or essentially cause dementia or pretty significant memory impairments long term, in addition to lung disease if smoked, and then also increase of other mood disorders. Now, the thing about marijuana is that cannabidiol component, that CBD component, we actually have. We have receptors throughout the entirety of our body for cannabidiol. We call these the CB1 and CB2. And we have a lot of these receptors actually in different parts of the brain, including these deeper structures of the brain, the basal ganglia, that are really a pretty heavy target for Parkinson's disease. So there's something here. And we know that we have these receptors, specific cannabidiol receptors in the brain. And we think that CBD could potentially modulate. We can modulate the role of those structures, and may even, it's been speculated, serve as a neuroprotective role. So knowing that there's some science behind it, we asked neurologists, and these are neurologists who take care of patients with Parkinson's disease, what do you think? What do you think, or what kind of role do you think CBD has or could have for patients? A lot of them kind of said the things that we'd probably guess, that it might improve things like appetite, pain, nausea, anxiety, and then everything takes a little drop. Things like tremor, stiffness, dyskinesia, those type of things. I think at large, neurologists are a little hesitant, or at least don't feel that it packs as much of a punch for. And there have been studies now, and even dating back to 2004, been studies of CBD and medical marijuana in Parkinson's disease. Probably the one that has the most evidence behind it is one where they tested it for the levodopa-induced dyskinesias, those extra movements that you can get with Parkinson's disease when you're at a high level of the dopaminergic medications, the dopamine medications. And based off of that, at least based off of that study and what we have so far, what we say is that these cannabinoid agonists and antagonists, CBD oil, CBD in any other form, whether it be levodopa-induced dyskinesias or otherwise, right now we just don't think that they have effect. We haven't found that they have an effect for those symptoms or otherwise. Okay, and that really dates back to some of these studies. And why the American Academy of Neurology, our big governing body, at least, and I think this dates back to just 2017 when they reviewed everything, for Parkinson's disease, right now we can say it's probably not effective or probably ineffective. But that doesn't mean that we throw the baby out with the bathwater, because again, these medications, especially CBD and the formulations of CBD, haven't really been effectively tested or rigorously tested, and all the different types of CBD haven't been tested in patients with movement disorders like Parkinson's disease. And so we have this article that came out not too long ago with some very, very good researchers and big names in the field of movement disorders and Parkinson's disease that said there still might be a chance. We still have to do the research and science to see if there is a role for CBD. And the American Academy of Neurology really backs this. While they don't support using or prescribing medical marijuana for neurological disorders right now, the American Academy of Neurology and their lobbyists do think that it would be very helpful if we could get this medication from a federal level snuck over into a Schedule II or above, so we can start testing this a little more rigorously, so we can really look at this. And so it's definitely not a stamp of no, never. It's more of a stamp of no, right now. Okay, we need more evidence. And I think this evidence is going to come because at large, while it's federally illegal, and this could very well have changed since I even picked up this slide, a lot of the United States now, statewide, are green, meaning that at some capacity, they have some sort of law or legalization of whether it be medical marijuana or recreational marijuana. And so there aren't many states left that don't have some type of law or legalization for marijuana, especially for medical purposes. Now in Michigan, and in addition to spelling marijuana in a very interesting way, just as of July 2018, Parkinson's disease just now made the list of conditions which for which you can get medical marijuana registration for, just as of July 2018. And that joins a pretty big list now of qualifying conditions. So there's a lot of things that you can have, many things no one wants, but a lot of symptoms and diseases you can have that qualify for medical marijuana in the state of Michigan. Now, to access it, because that's the next question, is that, well, one, I think movement disorder specialists and neurologists at large, we don't have a lot of evidence that it's effective for the symptoms of Parkinson's disease, but it's legal in the state of Michigan to prescribe it. So how do I get it? Let me try it. Right now, there's an application process where it's actually fairly simple. It's fairly simple going online and going through the application process with just getting a couple things, paying a small fee, and a fee as well, or designating a caregiver if they're going to be the ones primarily to carry medical marijuana, because they'll need a registration and a license to carry it if they're giving it to you or for you. And then you do need a physician certification form. And this form is a pretty much a check mark box and a signature from a physician saying that you have such and such condition. So this comes back to this, really this cartoon of as physicians, are we exhausting all the conventional measures and then just leaving the alternative therapies which have success rate behind? And I think right now, as a physician, especially one treating Parkinson's disease, which has a lot of symptoms that can be very challenging and tough to treat, I hope, and I think can speak for most of our physicians in the movement disorders division here at Michigan, that we want more therapies. We want more therapies, especially those backed by evidence, especially those that are legal and we're allowed to use to treat the symptoms of Parkinson's disease so we can help our patients. We just have to do so in a safe and effective manner. So in summary, right now, there are no dietary supplements that are proven to be effective in the treatment of Parkinson's disease. The Theracycle has proven short-term benefits in the motor symptoms of Parkinson's disease, and exercise has proven short and long-term benefits in Parkinson's disease, and is hands down the best alternative therapy. And marijuana, CBD and THC, so marijuana itself has no proven benefit in Parkinson's disease and carries risk for side effects. However, that subcomponent, that CBD, has distinct neurobiological properties which really demand further study for safety and efficacy, so we can start to utilize this, if it's effective, so we can start to utilize this in a safe and effective way. We're just not there yet. So these last couple slides are really just animations, and I know with Parkinson's disease, really the phrase "grab the bull by the horns" can, depending on what type of day you're having, can really be one that's tough. But whether it be with conventional therapies prescribed by your doctor, whether it be for motor symptoms of Parkinson's disease or non-motor symptoms of Parkinson's disease like those in mood and psychosis, whether it be conventional or alternative therapies, by all means, we want you to really grab the bull by the horns with this condition so you can take it down. Okay. So with that, I want to say thank you and happy to answer any questions.